Okay, good evening, everybody, and welcome to another episode of our Conscious Conversations series. So pleased you could all join us again. We had a bit of a break last week for the full moon. I hope you guys had a fantastic full moon intention setting ceremony at home. It's always a good time of the month to get clear on what you want. I am very excited this evening to introduce you to our guest, Dr. Raoul Goldberg. Welcome, Raoul. Thank you so much for taking the time out of your super busy schedule to chat with us.
It's such a pleasure. In fact, I'm very excited to be here.
Awesome. So this evening, we're going to be talking about the physiology of stress. And we've also called this month's series the Masters Series because the lineup of people we have are really masters in their fields who have been at whatever they're doing for decades. And it's just such an honor to be able to tap people with such deep knowledge. And stress right now is such a big topic for people in the changes that we're facing in the world. So I was just really happy to be able to get you on board to chat about that with us. And maybe just as a way of intro, I mean, we met, I don't know, years ago, but one of the most maybe poignant moments I remember is sitting at or lying on your bed in your room, and you putting that needle in my arm and then running, what was it that you put down? My ozone, that's right.
Ozone. Yes.
Yeah. And then I had this reaction where my entire body heated up like a fire, and wow, it was amazing. What an experience.
Okay. Yeah, you bring back these experiences, which are very common in my practice.
Okay, great. So maybe before we get into stress specifically, which is what the bulk of our chat's going to be about, maybe just give us a bit of a background as to what it is you're doing day to day, what your practice entails, what your passions are, how you're helping people, and then we can get into stress. Thanks.
Wonderful. Yeah, I've been working as an integrative medical doctor. That means holistic medicine with taking the best of all brands of medicine, conventional as well as traditional and natural forms of medicine, and really trying to build it into a comprehensive way of understanding illness and managing illness in the most effective way possible. I realized after some years working in this field, taking into account things like lifestyle and environment and toxic effects, that there was something missing. And that was the psyche. That if one did not include the psyche in one's management and in one's diagnosis, you were missing a huge part of the issue. So I trained myself as a psychotherapist some 18 years ago and started to integrate that into my medical practice in the consulting place, not consulting as a counseling therapist, but as a medical doctor using psychotherapeutic techniques to unearth the deeper root causes of illness. That really opened up for me the issue of stress, because I realized how important stress was in doing the biographical work or in doing the deeper exploration of illness, how important the psychosocial element was and how stress plays a major part in that. And through this practice over many years, I've built into my work this method, which we call the PATH method, which is a technique that enables me as a practitioner to diagnose on a much deeper level and manage, but also to help my clients and patients understand their own root problems and to start dealing with it and manage it. So that's a very big part of my work, to help people help themselves. And there's no better way than health issues.
Wow, that's amazing. I chatted to Dr. James Raff last month, and it was amazing. He mentioned a statistic that most medical doctors spend, I think it was only about 2 minutes with their patient in conversation before starting to write a script for them. So, I mean, you've clearly deeply understood and integrated that, having a relationship with someone and their whole story is such a big part of it.
Totally right. I think what one realizes that outcomes of illness are significantly improved by a good relationship with one's patients, a trusting relationship, and also helping the person become an active partner in the work. So I call my medicine participatory medicine because it's very much a listening and giving from both sides. And I need to get the maximum information that I can get from a client or patient in order to give the maximum input. And without opening oneself to the patient's experience, subjective experience, I'm missing the patient. And then I'm only trying to kind of put in my input from an objective so-called perspective, which often misses where the patient is completely.
Sure, that's profound. So actually, kind of teaching people to fish rather than just feeding them.
Yeah, completely. The whole practice of medicine today is be objective as you can, be as scientific as you can. Do not get emotionally involved with your patients. Don't allow them to spill over and express the emotions. Why? Because we're not trained ourselves how to deal with our own emotions. And so it's much safer to just stay in the headspace where there aren't emotions, they're just thoughts, and then you can navigate the problem safely. But you never meet the person. Really, the deeper connection is what's important in medicine.
And I expect considering them as mechanistic, movements rather than integrated spirit beings, that's going to be losing a whole lot of the story too.
Well, that's exactly it, because, the engineer and the scientist must be objective. So when you come from that perspective, you're observing an object, you're observing a phenomenon, but you lose the human character, the human nature. And so this is what's happened to medicine, that we are just looking at a body, an object, even a psyche and a personality is really an object that one is examining and manipulating according to what therapy one has. So I think it is vitally important to bring back the heart into medicine and bring back the artistry into medicine and to connect with body and mind, not just in ideas, but in action, in practice. And that's what I'm trying to do in my work.
Sure. Well, that's amazing. I mean, it's really a resurrection. I believe 100 years ago, that was medicine. Medicine came from those roots of herbalism and homeopathy and connecting with your patient.
Yeah. And the doctors then knew how important it was to have this connection with their patients. It was clear to the doctors that a visit to the bedside probably did more than the medicine that they offered. Just the knowledge and the trust, the doctor knows what he's doing, I'm going to get better, actually entrains the system, gets the person to heal himself. That's what happens. It's a kind of you can almost say participatory event that happens through that connection.
Sure, just the experience of being seen and feeling safe in someone else's care. I mean, that's medicine.
Exactly that.
Sure. Okay, fantastic.
Yeah.
Well, that maybe segues perfectly into talking about stress a little bit more, because obviously being ill is an extremely stressful experience for most people, if not all. I believe that WHO, not that I, go on what they say very much these days, reckon that the epidemic of the 21st century was stress. So maybe before we get into what stress is, why would they be saying that is the epidemic right now?
The science the research over the last 30 years has focused on stress because it became very clear in animal experiments to begin with that stress plays a major role in all kinds of conditions. Obviously, physiological ones, but also psychological ones. The animal experiments were conducted often brutally, and I would certainly not support that, as a way of going forward. But what it did do is it allowed the research to now recognize that stress was a major factor in health, and then came along a guy by the name of Robert Eder, who discovered the link, also using animal experiments, between the body and the psyche. And he found that stress, let's say the exposure of an animal to hot, cold, or fear actually created a whole range of physiological changes, including immune responses, downgrading the immune response so that the animals got sick, they got infections, and even some of them got cancers and so on. And this spawned the whole science of psychoneuroimmunology, which shows the link between the psyche, the emotional life, the neurological, neurosensory life, the brain, etc., and the endocrine hormonal functions, and that there was a very close connection between these three components. And this has placed stress on the map in terms of a relationship. I would say body-mind medicine has now found its own research platform, because this clearly brought together these elements between body and mind. So this has now, at the same time, I think it came at a time when people started using this word stress as a kind of buzzword for any discomforts that they were using. It's a very broad term that you can easily describe yourself being stressed, either physiologically, physically, or psychologically. It comes from the physics. As you know, you can stress a material. You can take something like tin, and you can bend tin. And you know what happens when you bend tin? It squeaks. It has a sound. It's a response to the pressure or the bending or the torsion, and so they coined this word stress. And then in 1936, a guy by the name of Hans Selye, a medical doctor, took this term. He was experimenting with also with animals, but he noticed at the bedside that the professors that he was following along in the ward were constantly referring to common ailments that many patients had. So they would say, look, this is a case of multiple sclerosis, or this is a case of cancer or something. But the symptomatology was very similar: malaise, discomforts, fatigue, insomnia, agitation. And he said, look, what's all this about? And the guy said, don't worry about that. It's all about the cancer, or it's all about the muscular sclerosis. And he said, no, there's something else going on here. He wanted to understand, where did these symptoms come from? And he discovered what he called the stress syndrome. And he coined the word stress. And he showed very clearly that when the system is under stress of whatever, we're calling it stress now, whatever trigger, it activates a certain physiological response in the body, which has to do with hormones, which has to do with immune functions, and with psychological changes. And these were very, very clear responses that set the stage for a whole lot of future work. So the stress research picked up on this in the 80s and started developing it more and more, to the point where today we know a huge amount about the effects of stress in the body. We know the hormonal changes. We know, for example, that there is an elevation of glucocorticosteroids or cortisol that is secreted by the adrenal gland, but the adrenal gland is stimulated by the pituitary gland. That's a gland in the brain. And the pituitary gland is the master gland for many hormones, like estrogen, like insulin, like all kinds of things like that, testosterone. But the pituitary gland is itself stimulated by hormones coming from the higher brain, from a section called the hypothalamus. And these hormones stimulate the pituitary gland to stimulate the adrenal gland. Now, the hypothalamus is linked to emotional centers in the brain. So anything like fear or anxiety or depression is going to have an influence on the hypothalamus, which will then influence this cascade, leading to ultimately the glucocorticoids evolution, it would seem, to manage stress. What happens? It produces a lot of sugar. So it has effects on the body to produce sugar in order that you can run away quickly or that you can fight. And it has a number of effects on the body. That's the one pathway that's been well researched. The other is the nervous system itself, the autonomic nervous system, which is also stimulated by the hypothalamus. This higher is an independent acting nervous system which controls the heart rate, the gut motility, the muscles, a whole range of other organs, and it produces, when it's activated, adrenaline. You've heard of adrenaline. We all know adrenaline is that hormone in us that is excited when we are excited, and it gives us that extra push, and it gives us that ability to sprint away from, a lion running after us in a moment. It's the first activation within seconds. Your body secretes adrenaline because your autonomic nervous system activates the adrenal gland, but it's another part of the adrenal gland. So that has been very greatly researched. That was known in the 1920s. A guy by the name of Cannon understood this and developed and recognized the adrenaline. Selle, 10 years later, discovered cortisone, glucocorticoids. And the two of them are the founders, one can say, the giants of the whole stress research.
Sean, that's amazing. So a lot of this knowledge has been around for a long time, and today people still question whether stress actually has a negative impact on your health, and we've known this for ages.
This is what confounds me. I can only say, the research is so clear about stress, and yet the practice of medicine neglects it or doesn't want to know about it or is not willing to face it, because I think it's a domain where doctors don't know what to do with it, because it's not, yes, if you're stressed, I'll give you a drug. The drug will suppress the stress, the anxiety. Or if your cortisone is up, I'll give you a drug, or I'll do something to reduce it. So yes, in that sense, it's recognized, but it doesn't change really the stress problem. You're just dealing with a symptom of the problem.
Sure, and I mean, that's an important point, because symptom-based medicine, I think, is the most common type. Trying to address the underlying causes is really where the healing begins. So maybe we could just define stress a little bit more clearly. How do you define stress as it relates to people?
Well, there's no consensus in the literature. Okay, so why is this? I'm doing a PhD right now in this field of stress, and it's just remarkable to hear the different versions and the different descriptions of stress. Now, the main problem, I think, is because stress is seen unidimensional. What I mean by that, it's focused on the body. It's biological. So everything is focused on defining it and trying to manage it on a biological level, even when it's psychologically induced, because it's very clear that, for example, depression will weaken the immune system, and you'll be much more prone to COVID-19, for example. We know this very well. The problem is that the definition is then defined according to a stress factor, a stress trigger, which causes the brain to react and produce a whole lot of hormones, etc. And the body tries to defend itself, or there's a stress response, and stress is defined always according to that one-dimensional perspective. That's the one problem. The other problem, there is a lack of differentiation between the trigger, the thing that causes the stress, and the response. So what is stress? Stress for me can't just be a response, which is mainly how people describe it. You know, I am feeling stressed. Stress is getting to me. Yeah, I feel this, that, and the other. That's a response. No, you have to include the stress factor, the thought of impending doom, the idea that someone is around the next corner, the heat that suddenly stresses my body. So stress for me is a dynamic interaction between a stress trigger that affects a living organism in a way that causes a response. Okay. Now, the response, you see, again, may not be injurious. It may not be harmful, because when you think of what's coming into your body right now, the toxicity that the body makes itself, the waste, the creatinine, the urea, the excess sugar, the sudden dehydration, the sudden little frights, that's stressful. Those are triggers, and yet, what's your response? You don't know anything about it. In fact, it allows the body to maintain your health. Because why? It's reacting to it in a healthy way, getting rid of that toxin, and that is what I would call beneficial. Even though there's a stress, it's so mild, the body knows how to handle it, and the result is homeostasis, equilibrium, something we call health.
Okay.
So when now the stress gets worse and it becomes more repetitive or chronic, then the body can't handle it, and now suddenly you feel the headache, the tension, the gut problems. Then you feel the response. And so what stress, we have to start looking at stress as the participation, the interaction between a trigger, a stress sore, as we call it, a stressor, and a stress response. And we also have to then decide, is that response helpful? We call that eustress. Or is it harmful? Well, we can absorb anxiety and depressive thoughts for at least 90 minutes. 90, I would say 90 seconds without any harm. We can push that up to, they found, 1 hour, and it still doesn't cause damage, because the body has such an ability to restore the damage very quickly. But push it over an hour, then you will have functional disturbance, and then push that longer, and that functional dysfunction, let's say, carries on too long, you then get structural problems. And there we get the degenerative illnesses, the arthritis, the multiple sclerosis, the diabetes, and so on, and the cancers ultimately. So that's a long-winded description of what I would define stress as.
So you have physiological inputs. This is environmental stresses like chemicals or toxicity or sudden changes to your environment and that kind of stuff. And then you have psychological stresses. This is thoughts and emotions and stuff going on internally for you. Which one of those to you would you say right now is actually more damaging to most people?
I can't say overall, but you know, if someone is smoking heavily, you're going to be introducing an environmental stress that is extremely damaging. And the body has a certain limit to its ability to protect itself. Yeah. Some people, you know, a small percentage of population are not affected because they've got very powerful lungs and very powerful clearing. They can clear that, but majority can't. The psychological stress is also dependent on a whole range of factors. because they found that one person can handle stress so much better than another. So it depends on the higher consciousness, your coping mechanisms, your environmental support, your social support, your ability to detract or distract yourself, exercise, etc. So on its own, when there are no coping mechanisms and no, let's say, supportive or protective mechanisms, I can't say which is more damaging. They both are. But I think it depends on the power and the degree of the stressor. If, for example, someone comes with a knife and stabs you in the chest, that is severe. If someone just, slanders you, or it feels bad, but it's not going to have an immediate damaging effect on your system.
I suppose we're also right now in our world, which is maybe why, it's the 21st century epidemic. We've just seen stresses from all levels increasing: environmental toxicity, poor food choices, lifestyle choices, and the impacts of a busy, non-ending schedule, etc., etc.
Yeah, that's exactly it. I think it's the chronicity, it's the lifestyle, it's the long-term, let's say, habitual, repetitive stress that has been shown to be highly toxic. You can show this in experimental studies with soldiers, for example, or with children who are under stress. Acute stress, they deal with. Chronic stress, they don't deal with well. And then, of course, it's mitigated with all kinds of other factors. So in the management, we can't just diagnose stress and say, this is going to cause you cancer. You can't say that. And anyone who says, something like that has only a very limited view of the stress problem. You have to look at the whole person. You have to look at the person's environment. And then you can say, there are multiple things here that are creating burden and stress in your body. And you don't have the resources. You don't have the ability to protect yourself sufficiently. You are liable to get ill. I can't say which it is, what illness you're getting, unless I do a deep diagnostic where you can predict. But I think it's the chronicity and the repetitiveness of it and the degree of the stress is important.
So in a world today where people still watch the news, I'm still flabbergasted that people do. That kind of consistent fear conditioning that the news is so well known for. I mean, that's clearly not going to have a good result in your own stress system.
One person, it's interesting that you say most people will be affected, but there'll be some people, for example, who do this consciously and say, I need to look at the news because that way I understand more about stress or understand what we need to do. And, here comes the higher consciousness where you can manage stress by giving it meaning, by finding ways in which you can deal with it better. I'm all for facing the darkness, facing the suffering, facing it and recognizing what it is. I think we de-stress ourselves if we do it in the right way, much more than if we don't know about it. The body then has to handle it. Whereas the mind is able to handle stress if you look at it in a certain kind of way. And that we can manage, perhaps talk about in terms of how you manage stress best.
I'd like to get into that in a minute, definitely. The one thing I thought we could just touch on too are stress patterns, stress memory, and stress dependency. I thought that was a fascinating point.
Right. Wonderful. Yeah, this has been so, I would say, elucidating, doing the biographical work and taking a patient through a process, a path stroke process. One actually revisits the past very graphically. So in a moment, through helping a person experience his current stress and putting him in a position where physically he can express it and allowing that person to look at himself in that position. We'll talk about it a bit more later on. He sees himself as a child. And he recognizes actually the stress from that age, whatever it was, that was there for 10 years is still within him. And so I realized you can't get rid of that stress. Why? Because the body memorizes it, the body absorbs it and parks it in the system. There is a resonant system, we call it the life forces, the life body, also known as the chi body or the etheric body. Rudolf Steiner talked a great deal about this memory body. Every bad experience and good experience is registered in the system. And of course, our memory is linked to that, okay? But the body experiences it actually all the time, unconsciously. That's the stress memory that will have an effect on the function. Why does a person have allergies, for example, into adult life? Well, you can trace this back to the memory. Very often, a lack of protection when they were young. In other words, oversensitive when they were young, not having the protection, and the body remembers that and remains sensitive to any triggers, and they can be physical, chemical, nutritional, etc. So that's the stress memory. The other thing is when you have played this stress behavior, let's say it's always learning to please people because you get a lot more attention that way, or that you avoid conflict, that creates a kind of dependency on that memory. And so you adopt a kind of personality that has a habitual stress built into it. And it's the best that they could do then. The child finds ways to survive because he's not taught or she's not instructed how to best deal with it. No one's there. No one probably knows that they're going through it. We all have to go through that way. And the genius of childhood is such that intuitively they know how to survive, just like any animal knows how to survive when there's danger around. And you construct the best personality and the best dependency on this set of dynamics, which happens to be stressful. And so this, I think, is the kind of process that happens that leads to many, many illnesses. And that's why working on this deep level is so vitally important, because how do you otherwise get to the root cause of your allergy or your lethargy, your hypothyroidism, your thyroid is no longer working, or your whatever it is, and even your cancers? You need to find the stress pattern, the dependency, and the memory for the person to recognize it, see it, and then start to change it.
Okay, so it's like following a golden thread back to your past, where you initially set up your protective response to a stressor, but as a child couldn't really integrate it on a conscious level. So then as an adult, you're just playing the tape over and over again.
Exactly that. But as an adult, you now have the reflective capacity and also the cognitive mindset to change it, to do something, and to bring in a new behavior pattern, and to also develop new resources that are latent. And we can talk about that with the management.
Yeah, let's definitely get into that now, because for me, that's really the key is, okay, everyone's stressed well beyond their coping level. So how do we help people? What can we give them? What kind of tools, tips, techniques, overviews? And also I wanted to just touch on how you even measure stress, because obviously that's very interesting.
Well, let's go to the first question and then come to the measurement. We have to, first of all, try and recognize it. We have to try and diagnose it. Of course, the body diagnosis is very important, and that's going to lead us somewhere. So if someone comes, let's say, with chronic fatigue, to my office, I see a lot of that. And this has been going on for years. I'm going to get a good background history, and I'm going to look at what are the things that possibly in the environment could be causing this. We know, for example, pollution might have a toxic effect on the body. We know the effect of brain fog. We can look at cell phones, for example. We know the electronic effect that chronic fatigue has. We know nutritional things. There are certain foodstuffs, overloading the body with too much food, eating the wrong foods. So we identify what are the triggers, what are the outer environmental things before anything else, because I never want to miss these things.
Sure.
So these are the things you can avoid. Once you know these things, you can start changing your lifestyle. You can start removing all these stressors and introducing much more healthier agencies. So if you're not exercising and stress is coming because you are too sedentary, you're not moving, that could be a stress in itself. You recognize this and change it, and you start doing exercise. Okay? If you recognize that you're living near a cell phone tower, get the hell out of that place. Yeah, and so on. We need to identify these things and then make those changes. But ultimately, they do not, especially for chronic illnesses, prove to be enough. Maybe if the illness isn't too severe. But I found with chronic fatigue syndrome, for example, I must investigate the psyche. And when I investigate the psyche, I find always, and I would say 100% of times, some factor that is depressing the system. It could be a judge, an over hard person. It could be someone hating yourself. It could be feeling guilty. It could be blaming yourself. It could be regret. It could be fear-based. It could be any of these things. And when you open it up, as we do, because it's very easy to show the effect of these psychological patterns. We ask the client to remember what it's like when they're feeling guilty. And when you do that, you'll see the person feels it in the body. They feel the actual effect in the body. And then I'll ask them, well, show me how that looks. And they will express it by closing their bodies down or feeling very small. And that is an expression of the guilty person, a guilt character, I can say, a stressful guilt character. I take that person out of that position. In other words, they stand up, move away out of that chair, shake off the guilty feeling. They're already feeling better because they've removed themselves from a stressful situation. And now I say, look at what you did in the chair. And they are able to see the imagined picture, the image of what they did, because it's still in the mind. And then from the outside perspective, they are looking at their guilty character. And now they see it. And that's sometimes a moment of real aha, real transformation. It can be very sad. Sometimes a person kind of has an emotional response, or it can be enlightenment, because now they see themselves from the outside. And that's the beginning of managing this guilty person, because the next question is, well, what are we going to do? You can't leave yourself in this state, and it's been going on for 30 years. So let's do something about it. And all I have to say is, what would you wish you could do? What would you like to do for your guilty person? If they are in a compassionate place and they want to help themselves, then they will say, I need to tell this person that everything's all right and he doesn't need to worry. And that's what he learns to do. So he creates not a stress character, but a resource character, someone who will help him. And he has to do something more. He has to remove the blamer, because a guilty person always has something saying, you did bad. You're a bad boy or girl. Mm-hmm. And so he becomes also a protector. So he may end up taking hold of the blamer and showing him the door. And then he embraces and comforts and assures the other one. Now, this opens up this participatory engagement. This is the partnership that is created between yourself and yourself, between a strong part and a weak part, between the parent and the child, between a healer and a mentor and a body that is weak. And enormous things happen when that, because now your healing is in your own hands, and you can practice this process of removing that stress. And that's a deep embedded in memory, as we said, that has to be erased slowly but surely through your actions, through changing the bad habit into a good one. And this can be learned in a couple of sessions so that a person can practice this on their own and do this work. And that has proven to be the most powerful way of removing root causes for chronic illness.
Sure. So you're basically doing deep psychological repatterning by getting a more elevated perspective on your own reactions to situations, to those triggers.
Exactly. Having done this now for 15 years, I realized, wow, I can see virtually the physiological changes that are happening. I can see the person's warmth changing, their muscle tone relaxing. I can see the blood pressure going down, like instantly. And so I said, I have to showcase, I have to show this some way. I have to measure before a process and after, and then follow this through so that I can really show this method does work physiologically. And that's why I started the PhD, to actually prove this on cancer patients who were stressed. Now, it's a very involved subject to research cancer patients who are stressed, especially in COVID time. So currently, what I'm doing is, because the first part of that research had to do with first finding a tool that could measure stress accurately. My thesis currently is about finding such a measurement tool. And so what I'm doing is I've invited patients and friends to come to have their stress levels tested. We need 200 such people. And what we're doing is we're taking 4 biological markers: salivary cortisol, salivary amylase, which tests also the autonomic nervous system. So 2 saliva tests, a heart test, which tests the heart rate variability. And that's not just the heart rate, but the rate, the ability of the heart to vary its rate. And this is a phenomenal thing. Here you have it. When you observe on our instrument the heart rate, you see it's not 72 beats per minute as you would have after a minute. It's sometimes 120, 64, 85, 71, 73, 68. The heart is constantly varying. Why? Because there are constant stresses coming into the heart that it has to balance out. So we test the variability of the heart, which is a measure of your ability to manage your stress. If it's high, less stress in your body. That's the third one, heart rate variability. And the last one is what they use for the lie detector. It's called electrodermal skin conductivity. It measures the conductivity between 2 fingers. You put electrodes on the fingers, and it tests the amount of conductivity which is dependent on sweat production, which is activated by the autonomic nervous system, once again, which is all about adrenaline. So these are the 4. And then we have 4 psychological markers or measurements, because stress is not just biological, it's also psychological. And I believe it's also sociological, because it has an effect on your community. That we are measuring these 2 parameters, and we are going to amalgamate the 8 and try and find one single index together that would be able to give us a more accurate stress level.
That's amazing.
That's what the stress test is. So I welcome anyone who would like to have their own stress levels tested free of charge. It's a free assessment to connect with the link I think you're going to provide.
That's amazing. Donna just posted that in our chat screen. So thank you so much. That's such an amazing opportunity. I wish I was in Cape Town. I'd come around.
Well, we'll probably be doing this because the research is going to be ongoing for a while.
So
I have to do this by the end of October. I need to wrap it up.
Okay, great. Okay, well, maybe I'll get down there. So I just wanted to recap quickly. I mean, would you say that if you only focused on the physiological triggers in your environment, that the subconscious patterning of the stress response is so strong that even if you removed most of the things that are damaging you and stressing you physiologically, you would just recreate others to fill the space because you haven't actually dealt with the intrinsic, that wounded child hasn't actually had a moment to be freed?
I think there's truth in what you say. I do not want to make out for your listeners that every physiological stress that we have is psychologically, founded in childhood trauma.
Okay.
It may not be so, but I do think that what you're saying is correct. Lifestyle, bad lifestyle, for example, always has a psychological component because you make choices. You make psychological choices based on your feelings, based on your ideas, based on your behavior, and that results in dependency, addictions, and all kinds of toxic things. So I think you will always find a psychological factor. The more a person is prepared to look at their own personality in the face of the physiological stressors that they have, the better for their health. No question about that in my mind. And so I would always approach it from both sides.
Okay, fantastic. Sure. Yeah, like your internal framework really kind of outpictures itself into your external reality, in a sense.
That's true. Yeah, we can't, the thing is, Peter, we can't remove ourselves. We come here not just a body like a robot, although, that's what maybe they're trying to get us to become one day. We aren't just that. We carry our whole psyche, our whole spirit, our whole environment, our whole background with us. Therefore, we have to look at the person experiencing the damage or whatever it is. We have to look at that. That's where it all starts, with the psyche.
Oh, I'd love for us to go straight into the aromatic deception right now, but I don't think we have the time or the space.
Indeed.
But there was so much amazing stuff there for everybody. There are a few questions, so I think this is the right time of the evening for us to put that out there. If you guys have any questions, you can type it into the chat screen. Portia's already asked whether wearing a mask has an effect on stress or anxiety on the heart and the body. Tricky question, Portia, going straight for the jugular.
Go for it. I'm ready.
Oh, did you hear that one? She said, does wearing a mask have an effect, stress, anxiety, heart, body?
Well, it depends on who you are and how you think about this and what your fears are or no fears. Some people will be highly stressed just wearing the mask because they fear that they're going to be infected and therefore they need the mask. And other people will wear the mask and be so angry because they're forced to wear a mask, and you'll be stressed that way. It really depends on your character. Again, where do you come from? What is your background, pattern? What is the memory inside of you?
Okay.
And it's always fascinating to look at that from that perspective.
So basically, don't wear it all day because you're not going to get enough oxygen, but make sure your head is seeing it in the best possible way. It's like there's always content in life. Life's always giving us content, and it's our, the way that we integrate it and see it and think about it that really depends on our level of stress from it.
Exactly. Perceptions and the belief systems that we carry and what we believe, the authorities are telling us. This makes a huge difference to the way we behave and the way we think and feel.
I think
help
a
you
lot
to
of
believe
people don't recognize that they have power to modify their behavior there. I mean, my mask is this beautiful see-through netting gauze material. I can breathe, I can speak, people can see me smile. It's lovely, and it's entirely legal.
It's highly legal or illegal?
No, it's legal. It's to the letter
Legal.
of the law as it's written. Absolutely.
Exactly.
Any
Oh, you
homemade
must,
item.
yeah. Why don't you patent it, Peter?
Ah.
Okay,
Guys, any other
next.
questions for Dr. Goldberg while he's still here? We've got 5 minutes left. Oh, I think we may have done such a good job. I don't think I missed any. I'm just looking back on them. I think you're going to have a lot of people joining your stress study.
Well, we welcome them.
And oh, there's a new message. MW wants to know what foods are best for that gland. We spoke about a few glands, MW. Which gland are you specifically referring to? The small one.
The pituitary gland.
Let's talk about that one. Yeah.
What foods? I think foods that nourish the brain. The brain is very fat rich. So phospholipids, foods that contain oils, nuts, I would say your superfoods, some of them are brilliant. Chia, I would also say the brain needs a lot of sugar, glucose, but you need to give it in the right form. So are you going to give it in pure sugar form, or are you going to give it in fat form? I would rather say a lot more natural fat foods would be very good for the pituitary gland, and very little sugar foods, because that's going to have a deleterious effect. Yeah, I think there are, lots of supplements. I prefer to do it through the food. So I think, yeah, foods that contain high levels of lipids, healthy, high fat content.
Fantastic. Thanks for that. Maybe we can just do one more. Where was it? Megan had... oh, there we go. Megan Smith. She wants to know what would be your number one tip for supporting a stress-free life?
Wonderful question, that. Number one. I think the recognition that stress is not the enemy. It is something to embrace. It is something to get to know. Stress is a part of the human condition. Stress is about you learning to overcome it. If you know something about your own stress, you will find the power to overcome it, and that is the best I can offer. Find a way to overcome your stress and you'll become a healthier human. So stress is really a vital part of growth, development, of transformation, and of healing. And I think if we start to see this and take the fear out of it, you're moving into a higher awareness of what stress can bring.
So again, we're doing a powerful reframe here. Instead of perceiving it as something negative, you're seeing it as a gift that's going to provide you with some kind of learning and growth. Right.
Even though it causes suffering, even though it might cause dysfunction. If you know enough about stress, you won't let it cause you irreparable harm. You will catch it early on and you will turn it around, and it will become something that gives you more. And you will learn to tame it and overcome it. And that's, I think, the message. We can't afford to deny the darkness or push it away. We need to embrace it and overcome it, and then the light is much brighter than if we just strive for the light. So that's the message, that's the metaphor.
And I found that just as a simple technique for me, breath is one of the most profound tools, just to drop into that space of observation instead of reactivity.
Absolutely. Exactly. It gives you the opportunity to see yourself in a different way. I'm so for that. Breath is a fantastic, and it also connects you with your body, right? And fine tunes your sensitivity to being able to sense where you are stressed, and then you can do something about it. Help the body in that way.
Fantastic. All right, I think we've covered all of them, and our time is pretty much up. Thank you so much for amazing pearls of wisdom you shared with us and everyone on the call this evening. And yeah, I think we're gonna have lots of replays on this one. And if you guys have friends and family who weren't able to be on the live call, we will be making this available online on our website within the next few days. The address, I'm just going to paste quickly into the chat screen. All of our past talks are available there for you guys to check out. I don't think I sent that to everyone in meeting. Let's do that again. So you can check that out. And obviously get in touch with Dr. Goldberg directly to join on the study or to get an appointment so you can get to experience his path method. Having experienced it myself, I mean, it is profound. It's such a great way of just shifting your perspective so that you can see yourself from a different place and integrate stories that you've often felt just too scared or too ill-equipped to deal with. So highly, highly recommend the process. Thank you so much for bringing that to the world and for sharing your gifts.
Peter, thank you so much. I want to compliment you for a really beautiful encounter. You know, one can only give what one has if there's someone there who's open and asks the right questions, and you've done that. So thank you so much. And for everyone else that was here, without them, we can't have a show. And you and I were just talking to ourselves. So thank you, everyone, for being around.
And thank you for Donna, who's in the background there, busy prompting and helping out and making sure everything's working. Oh, look, there she is. Hello. Thanks so much. All right.
Without this amazing human, I could never be here.
Oh.
You know, she is just the greatest networker and supporter. But thank you, Donna.
Okay, awesome. Okay, great. Thank you. We're going to sign off now. Lots of love and enjoy the rest of your evening. And we'll chat again soon.
Thank you, Peter.
Okay, great.
Wish you well.
Bye. Bye.